So can you please confirm your name for me?
Hi, doctor. I'm Sarah.
Sorry?
I'm Sarah.
Okay. Well, can you please confirm your age as well?
I'm 24, doctor.
Okay. So, nice to meet you, Sarah.
Nice to meet you, doctor.
I can see that you're here with some concerns, like you're having some discomfort in your hand.
Yeah,
Is that right?
yeah, doctor.
Can you can
It's
you tell me a bit more about it, please?
it's just very weird, doctor. I mean, it just gets very I don't know, light sometimes, dark sometimes, and my hands and fingers, and starts to hurt a little
Mm-hmm.
bit.
Okay. So, do you have pain?
Little bit, yeah. It hurts when it becomes like that.
Okay. Do you have it in your both hands?
Yeah, both hands.
Okay. Are you able to do the functions with your hands?
Yeah, I mean, I can, but when it happens like that, I can't really do anything with my hands out. It hurts.
Okay. So how often does it happen?
It happens earlier. I mean, it used to happen less, but now it's happening way too often, at least once a day.
Okay, I'm really sorry to hear that. So, is there anything that makes it worse, like cold or anything?
Yeah, now that you mention, yeah, whenever I don't wear my gloves, go for jogging, it kind of starts to happen. Yeah.
Okay, okay. So, is there anything that makes it better?
I guess just warming my hands kind of helps. Yeah.
Okay, all right. Do you have anything else apart from this? Do you have any other concerns?
Like what, doctor?
Okay. Do you have any problem while having food?
No,
Have you noticed any other rashes in your body?
no, doctor.
Okay. So, any fever recently?
No, doctor.
Okay. Do you have any numbness in your hands when you have
Um,
this episode?
yeah, kind of. It gets tingling, numbness. Yeah.
Okay. So you are having pain and numbness and tingling, and you're having some discoloration in your limbs. Is that right?
Yeah, doctor.
Okay. Anything else that is concerning you?
No, nothing else. But yeah, I just want to know what this is. I just want to get rid of this problem.
Yeah, I will help you with that. I need to ask a few more questions. Is that okay?
Yeah, sure.
Okay. So do you have any medical conditions?
No, doctor, not at all.
Are you on any regular medications,
No,
including the
doctor.
over-the-counter ones?
No, doctor, not at all.
Okay. So does anyone in your family has a similar condition?
Actually, yeah, my aunt actually has the same thing. She takes some medications for this, but yeah, I haven't really spoken to her in a
Mm-hmm.
while.
Okay. So, do you have any allergies?
No, doctor.
Okay. So, do you smoke?
Yeah, I kind of smoke a lot. Yeah.
What do you smoke?
Cigarettes.
Okay. How many cigarettes do you smoke in a day?
Like 20 maybe max.
Okay. All right. So, do you drink?
Sometimes, yeah.
All right. So, okay. So, how was your diet?
It's good, doctor. I eat everything. I eat 5 portions of vegetables every day.
Okay. Are you physically active?
Yeah, I would say I am. Yeah, I go for playing football. I actually, now that you mentioned that, that's actually what I wanted to talk to you about. I have a job offer to become a PE teacher.
Uh-huh.
Yeah, and in a school, and yeah, I'm really excited about it. But this is something that's really scaring me because every morning I might have to go in the cold, and I don't know how I'm gonna manage this.
Uh, Okay, all right. Well, I understand your concerns. Okay. Have you noticed any weight loss recently?
No, doctor.
Okay. Any night sweats or any lumps or bumps in your body anywhere?
No, not at all.
Okay. Well, I would like to. Do you have any expectation from today's consultation?
No, I just wanna get
2 minutes remaining.
treated for this, doctor. I can't live with this anymore.
All right. So I would like to examine you now.
Okay.
I would like to take your blood pressure, your pulse rate,
Okay.
your breathing rate, your oxygen levels, your temperature.
Okay.
All right. And I would like to examine your hands as well.
Okay.
Okay. Okay. Thank you for letting me examine you.
Okay.
From what you have told me and from my examination,
Hmm.
it seems like you are having a condition called Raynauds phenomenon.
Oh. Okay.
Okay, so it is when the blood supply to your hands doesn't go properly,
Okay.
especially when there are some triggers like cold environment.
Oh. Okay.
Are you able to follow me?
Yeah. Yeah.
Okay, so yeah, it is not a serious condition,
Oh.
but
Okay.
what we can do is I will be running some tests to
Okay.
know what the cause exactly is.
Okay.
If you're having any other syndromes along with this, okay,
Sure.
okay, I will be doing a routine blood,
Sure.
okay, your liver function test, your kidney function test,
Okay.
and and mm,
But
yeah,
what
and
is it?
some antibodies as well.
Doctor, I know my aunt was really doing well with medications. Can you just talk about that, please?
Sorry.
My aunt was doing really well with medications. I just want to get those medicines. I think I'll be faster that way.
Okay.
Move on to the next
So
station.
we can give you some medication to reduce the symptoms. We can give you
Sorry,
nifedipine.
doctor, the
Uh,
time is over. But yeah, you can continue. Yeah.
yeah, okay.
No, no, just
Yeah,
finish your
that's all right.
sentence. Yeah.
I'm not sure. Is
Just
it
finish your
Reynolds?
sentence.
Is
It's all
it is
right.
right?
Yeah, it was good. You did
Sorry?
really well.
Yeah.
You did really
I'm
well.
not sure.
No, no.
Yeah.
Could you do you want to complete the sentence about the medications?
Yeah. We can give you some medication called calcium channel blocker. Its name is nifedipine. Okay, and we can avoid the trigger factors like cold exposure, going outside during the morning.
Absolutely. Yeah,
Yeah,
that's
yeah,
perfect. Yeah, you've done really well. There's a few pointers that could help you a lot. Examiner will tell you.
yeah.
I'll just give it to
Mm,
examiner.
yeah.
Performance. That was great. Um,
Oh,
yes, don't worry about
yeah,
it. So, a couple of things that I would like to take you with. So, it was very interesting
yeah,
how you actually approached the case. As soon as you read in the candidate information, did you understand that this was Renaud's phenomenon?
yeah,
Oh, you did.
yeah.
That was
I
good. That
understood.
was really good. Yeah.
Yeah,
So you were
yeah,
already formulating your mind on, what to ask and what not to ask in the candidate information because you had a lot of time, right?
yeah, yeah. Right.
So
Yeah, I
yeah,
should have done better because I knew it was Reynolds. Yeah,
I mean, I think the important thing over here is there is
yeah.
total of 8 minutes, and you spent
Mm-hmm. Yeah,
more than six, almost 7, 8 minutes.
Mm.
I mean, I wouldn't say 7, 8. I would say around 6, 6.5 minutes data gathering.
Mm.
So
yeah,
you didn't have
yeah,
time at all for management, right? Like
yeah,
it,
yeah.
it, it consists of
Yeah,
4 marks. You were already trying to rule everything out, and I mean, what was the point of actually once you got ruled, things were already ruled out, and you kind of managed to make it sound
Yeah.
like primary,
Yeah. Yeah.
Reynolds phenomenon. You were just losing marks in
Yeah.
management after that, right?
Yeah. Yeah. That's true. Yeah.
So let me try to help you out in how you can actually manage this
Yeah.
better. So
Mm-hmm.
initially, let's look at the candidate information. Over here, if you see, it's a 24-year-old female, right? So we know the
Mm-hmm.
age, and we know what is the problem, which is hand discomfort and discoloration. It could be a rash
Yeah.
also, for all you know, but I mean, it was
Yeah.
lucky for you that you thought it was Reynauds and it actually came in, because discolorations are usually, hand discoloration, because you don't know where it is. It could be, discomfort where, it could be the fingernails, or,
Yeah.
we don't know where the issue is because it's very ambiguous about the hand.
Mm-hmm.
So we know that there is something related to the
Yeah.
hand, and Reynauds can be one of it. It could be a
Yeah.
rash, it could be a melanoma, for all you know, right? And
Yeah.
the other
Yeah. Yeah.
information that we have is she smokes 20 cigarettes a day and has a new job as a physical education teacher. So those are important clues you
Mm-hmm.
can get. So you know that it's something related because that information has been given to you. You can probably use
Mm-hmm.
that to understand further about it, right? And
Yeah.
other
Mm-hmm.
information, special notes. So usually the information is always given in other information and special notes, right? Those are the informations that
Mm-hmm.
you need to also get out of the patient. So the other information that is
Yeah.
that the aunt had similar history. So you can understand that there's
Mm.
some genetic disposition to this, right? Kind of
Yeah.
like by just looking at
Yeah.
this much. And what is your task? You must address the concerns and plan a management plan, for which you did not have time,
Yeah.
right? So if the task
Yeah.
itself
Yeah.
tells you that it's a management plan, you have to think forward, like what you need to do. All right, let's
Oh
go about
yeah.
how we can ideally cover this case in 8 minutes. All right.
Yeah. Yeah. That was the main part, and I missed it. Right.
That's all right.
Yeah.
Don't worry about it. Let's talk about
Yeah.
it. Let's see how we can improve it, right? And
Yeah.
so
Yeah.
let's start. Now, you introduced yourself, and you asked for the name.
Mm-hmm.
She introduced herself as Sarah. Sarah could be any Sarah.
Mm-hmm.
Who is Sarah? It could be Sarah Peterson. It could be Sarah anything. You have the information
Oh
of the
yeah.
full name. Make sure you ask that, because it's a patient identifier. You
Okay.
cannot go wrong here, because these are information that is
Mm-hmm.
provided to you. If you do not confirm this information, your marks will be slashed, right? So you,
Okay.
since it's already
Uh-huh.
provided to you, maybe use it because you will save on time. So you can ask, is this Sarah Johnson that I'm speaking with? Then she'll say yes. So how much of that time difference do you get? You just get one answer, right? So if it's
Yeah.
given to you, just use
Yeah.
it, because it gets a little tricky in the other
Yeah.
LGBTQ
But the name
cases.
was not given, right?
Of course, the name is given. I mean, you didn't. Okay,
Oh, is it?
let's just go back. All right. Okay, sorry, my mistake. The name was not given. All right. So then you have to ask for the full name,
Yeah.
right? Because
Yeah.
ultimately
Yeah.
you're
Yeah.
documenting everything that is written, right? So even though your
Yeah.
aunt is
Okay.
just stick
Oh
with
yeah.
one name, you have to make sure, because here
Yeah.
are some
Yeah.
of the problems that comes if, especially in pediatric cases. Like you ask,
Mm-hmm.
you'll say, "Who's your son?" "My son is Jacob." "Jacob what? Could you please confirm
Yeah.
the full name?" So if
Yeah.
usually, that's a good point that you
That's
brought up. If the name is
yeah.
given, try
Yeah.
to use it, right? If you try to use it,
Mm-hmm.
then you
Yeah.
actually save time. So the lady's name was Sarah
Yeah.
Johnson, by the way. And could you please confirm your
Okay.
age, which is 24, which you did nicely. All right, so the introduction is done. So that should take like probably 30 seconds for you. Now, after that, emphasize on the
Mm-hmm.
problem, understand the problem. So the problem that you know is a discoloration. So you ask her, you did that very nicely. You asked her that, from my notes, I can understand that you've got some discomfort with your hand and discoloration. Could you care to elaborate a little bit more? Then she'll tell you the problem.
Mm-hmm.
Like literally, she's been actually having it for a while now. So she'll actually tell you that
Mm-hmm.
I've been having this, and now it's just increasing, and I can't do work.
Mm-hmm.
It gives me pain. She'll tell you a whole lot of list of problems, right? Or she might not. She
Yeah.
might just say
Yeah.
that I just have the discoloration and it's really irritating me. So now you have to go into the Socrates question to understand how long the discoloration is, what is the duration of this
Mm-hmm.
discoloration, how frequent it is, right?
Mm-hmm.
So this is the
Yeah.
time immediately after your introduction that you need to understand the presenting complaint, which is the discoloration and
Mm-hmm.
discomfort, right? So understand that by asking key Socrates question. You don't have to ask everything. You need to understand what to pick and choose, because you need to understand, is it relevant to you. You need to understand main thing.
Yeah.
A couple of things that you need to understand is, as soon as you understand it's Reynauds, which you understood from the candidate information, that was great. So if you understand it's Reynauds,
Yeah.
what is the main thing that you have to do about Reynauds phenomenon? What do you have? What is the main thing that you need to do in your data gathering when it comes to Reynauds? You have to differentiate it, whether if it's primary or secondary. So let's just understand a little bit about
Yeah.
Reynauds phenomenon, right? So we'll have a little more context. So it's basically the exaggerated vasoconstriction, right? In response to cold
Yeah.
as well as stress.
Mm-hmm.
Cold you identified
Yeah.
very nicely, that's very good. And now it can be primary, which has no association to diseases, or it could be secondary, which could be associated diseases like SLE, scleroderma, or it could be actually associated to any medication or any lifestyle. Suppose if their work actually involves them working with vibrating tools, that could be problematic. That could
Oh
be a
yeah,
trigger
that's
factor.
true. Yeah.
So that's what you're actually thinking about risk factors over here. Like what is she having? Is she having
Yeah.
primary or secondary? Because if it is secondary, you need to investigate further, right? That's the
Yeah.
thing that you are
Yeah.
trying to understand, right? Is it primary or secondary at this point? Because you understood it's Reynolds.
Yeah.
Now, other things that you need to understand is, what you need to get out of her is, ask her to describe it. Like, what is it? Like, when you say discomfort, discoloration, can you just describe what you're feeling? Because it has a very classic tricolor change of the fingers or wherever she's experiencing it, where it goes white due to lack of blood flow, and then it goes to blue when there is lack of oxygen, and then after that, on reoxygenation, when the blood flow returns, it becomes red, right? You can actually see these
Yeah.
three distinct things, right? So if that is something that
Yeah.
she's
Yeah.
experiencing, you should get it out of her. In fact, these are the open-ended questions that you want answered, right? And other associated symptoms about feeling numb, like what is the degree of it? Because if the oxygen level is less, it could not manifest. I mean, the duration of lack of oxygen is less, it might not actually manifest to anything that severe, right? And primary means
Yeah.
there is no
Yeah.
underlying cause. So usually, if you see Raynaud's phenomenon a little bit deeper, primary is the usual presentation. Usually, patients have primary, and more important, other
Okay.
things about primary is, it actually
Yeah.
happens in people. Usually, it first starts to present between in their teenagers up till the age of 30. So
Okay.
if you first start having Raynaud's phenomenon after 30 or before 12, usually you have to go in straight away with more investigations. All right. So that's one, we will get there, but that's one thing that I want to tell you about primary, Raynaud's phenomenon. And after
Yeah.
that, so you can tell her, now this is like the explanation of what is happening. I've given a little simple way of how you can explain it. So they actually overreact to cold, right? Because of which they shrink or they constrict more than
Yeah.
what is required, because of which your
Yeah.
blood supply to those regions is diminished or reduced, right? So
Yeah.
that is the main thing. And what all are you supposed to rule out? What are the conditions associated with Raynaud's phenomenon that you have to rule out? Because you asked a whole lot of questions about fever, weight loss, because it's very evident that they don't want to hear that. They want to hear about the conditions that
Yeah.
could be associated with Raynaud's,
Yeah. That's.
right? So what are we actually looking for? We're actually looking for rheumatoid arthritis, where the questions you could ask about was morning stiffness, joint pain, any family history, right? Family history you kind of got. So you could have asked the aunt, does she have any other condition? Like, you got that the aunt has this, but you don't know, like, what is the condition that she has. She just said that my aunt has this, she takes medication, so I want medication. Like
Oh yeah. Yeah.
that you understood is the knowledge of this
Yeah.
person. So now you need to,
Yeah.
what is your job is to give her the correct knowledge and bring about the links of what her aunt has, and how it could be the same in her, right? So to do that, you need
Yeah.
to know what the aunt has. right? So these are some of the important questions that you could have asked about, family history. Do they have any family history? Otherwise, Berger's disease, I mean, smoking is actually like a risk factor, right? Claudications, ulcer, and gangrene. And then you have SLE, right? And in SLE, you're actually looking for if you have any photosensitivity, especially when you go out into the sun. I mean, do you start getting a rash, which is, typical malar rash on your face, right? Or if it is so in Sjögren syndrome, you're looking for dryness. So these are the questions of, other symptoms that you can ask, right? Associated symptoms to rule out if it's secondary. But if at all you get a hint of secondary, you have to further investigate. So you got all this idea from, all right, now let's go back. So you have to elaborate the presenting complaint, ask about the importance of this question, like since when are you having, since when will actually give you an idea of if it's secondary or primary. Like I told you, primary is most likely first manifest in the teenagers up till the age of 30, right? So if she's in that age gap, she is mainly a primary symptom, I mean primary candidate. So if you see she's 24, so it's most likely it is primary. So you get a hint there as well. Right? So since when, how often, how is this affecting your life? Because this is the management that you need to give, right? And further came after those are questions about family history, any past history, what medication she is on, right? And then when you're asking about smoking history, you have to be very tactful about that you're invading into their private space. So whenever you're asking about smoking history, you always have to signpost, right? Because so I would like to ask you a few questions about your lifestyle, and this may be a little sensitive, so please bear with me. This is important for my consultation, right? Because that's so then she'll reveal that, yeah, I'm a smoker, because otherwise it can come off wrong, right? Anything that you think might come off offensive, you signpost. Because obviously if I ask you, do you smoke, then it actually it feels like you're actually hurting them, right? It kind of, you'll be taken aback, like, I mean, no, why would you ask me that? That's the first reaction you get. So you have to signpost these things, right? That's very important. That's what they're looking for, because she gave you so many this candidate gave you list simulator gave you so many opportunities to do IPS. Like, I can't do work, I get pain in my hand when I do work. So empathize with them. I'm so sorry, I can totally understand what you might be going through. Let me ask you a few more questions and let's get to the bottom of this. You're showing them consolidation with them. I understand what you're feeling, and let's literally get to the bottom of it, and let's just fix it. That's what you're trying to tell them. So if you reassure them like that, they feel like they've come to the right person, and that's what you want to do as a doctor, right? You want them to have faith in you. All right. So smoking history. So you've asked a little bit about smoking history, about how much she smokes, but the important question over here to ask is, have you ever tried quitting? Because we can actually say that this issue that she's having of Raynauds phenomenon is directly linked to smoking. That is one of the statements that you can make, right? So we need to know, has she tried quitting, because that is one of the management you have to give, because you're kind of relating that this can be a risk factor, right? So if you identify it as a risk factor, you have to give it the management, right? So that's the so you need to understand from which level you need to give that management. Has she tried quitting? Otherwise you will tell straight away, please, you need to quit. No, but you need to understand, has she tried first? Because if she's tried chewing gums, or if she's tried nicotine replacement therapy, we can always direct her to something different, right? And in this case also, nicotine replacement therapy and all will not work, because those are some of the things that can cause the vasoconstriction, right?
That's true.
So that's another thing that you're actually looking for, like, did she do that, right? Am I missing something? These are the questions that you need to ask, because smoking history is already given to you in the question, if you see, right? So so you needed to investigate that a little further, because that's given to you in the question, so that that is something that people are looking for you to ask more questions in, right? So a short, crisp Socrates, and then a P. Maftosa, which is important. In this P. Maftosa, you have to ask about past medical history for sure, because you need to understand if they have any underlying causes, if they're taking any medication, if they have family history, what is their occupation like, and the lifestyle of smoking, right? Everything else that you will ask, you'll be wasting time at this point. You need to understand that you took a 6 minute, 6.5 minute time to data gather. So you can cut it short. You can see, right, allergy and all. There's no point. Like, what are you going to do? Because the first, because in this case, the first treatment you're giving will be lifestyle modification. So let's,
Should we always ask about flaws? I mean,
why would you want to always ask about flaws? I mean, like, what would you
no,
gain
right?
out of
Yeah,
it?
okay.
Flaws
Because
is very
this
specific to
academy teaches
cancer.
us, yeah.
I'm sorry, please continue. I didn't hear that.
I mean, the academy teaches we should always exclude flaws. That's why.
Yeah, I
Yeah.
mean, I understand, like, you might, that might be because that is one of the most dangerous things that can happen to a person. You don't want to miss out cancer. But the thing is that you need to
Yeah.
understand the situation, right? You are actually
Yeah.
going
Yeah.
for an exam which will deem you to be a practicing doctor. So, at a situation where you understand it's required, you need to ask it. That's what they're trying to. I mean,
Yeah.
I would say if at all you suspect cancer, ask it. But at this point, I don't
Yeah.
think I wouldn't suspect cancer
Uh,
at this point. Yeah.
yeah. Because I knew the case from the beginning, and I didn't want to ask, but yeah, because
It got a little, yeah,
yeah.
hard
Yeah.
driven to hear.
Yeah.
Yeah, that's something that also we are trying to improve. You see, try not to
Yeah.
use stock phrases where, you're trying to seem monotonous. You're only using one things like, oh, I understand your concern. Like if I say I'm having pain, oh, I understand your concern. Oh, so tell me a little more. Like it comes out very mechanical, right? Like try to actually have
Yeah.
a
Yeah.
conversation
Right.
with them and actually rule out things as it's coming. So that's also something that we're trying to improve amongst the students, because these are things that the
Yeah.
examiners will notice. Like, why are you asking an unnecessary question when you don't have time? Like, it kind of goes, even though the academies might be saying it, ultimately you are going to be marked by the examiners, right? So you need to understand what
Yeah.
is
That's true.
important for
Yeah.
a case and not. And yeah.
Mm.
All right. So the smoking history is important here. Family history is important, and then ruling out differentials. We spoke about a lot of differentials and the related symptoms that you could have asked to rule them out.
Did I ask about back pain?
No, but why are you thinking back pain? Can you give me a little idea? With
I
rheumatoid
don't know.
arthritis.
The only thing that I had in my mind was CREST syndrome.
Okay.
Yeah, and that's why I asked about swallowing difficulty.
All right,
Yeah,
okay, yeah.
yeah.
Yeah, I mean that, yeah, yeah.
I thought of asking him. Yeah,
I mean, that's what, no, just one symptom from each disease when you're thinking. So you thought of the
yeah,
CREST
yeah,
syndrome and you
yeah.
asked for the swallowing difficulty. That's good. You can also, well, what about SLE and rheumatoid arthritis, right? A couple of those
Yeah, yeah, yeah. Right.
Sjogren's, right? I mean, you might be thinking
Yeah,
that I didn't ask more questions about the CREST syndrome, but what about the other diseases also you could have ruled out, right? Like morning stiffness, morning
yeah,
back
right.
pains, and dryness,
Yeah, yeah.
photosensitivity.
That's true. Yeah.
Yeah, so don't get too focused on one thing. Think about, because see, ultimately, after whatever you say, you're going to hand her a lot of leaflets and pamphlets. So that's for you. Think about it like this: you're giving her an idea of what she has, and now you're going to give her the important reading material for her to find out, research, and be informative about what condition she's suffering from. That is your role as a
Yeah, yeah,
doctor. You're trying to connect the person to the disease. And in between, whatever words you can say to make that connection as strong is your role, right? They need to understand what they are suffering from, and you're the one who can interpret it for them, right? Think of yourself like that. That is
yeah.
that is
Okay.
basically
Yeah.
your job. That's what you're trying to bring about. All right. Okay, so now let's move forward. You asked about ice. That was very good. I'm very impressed by your ice questions. That's good.
Thank you. Okay.
All right. right. And
Totally.
yes, so now explaining your diagnosis. So try to explain it as layman terms as possible. You mentioned cold, which is good.
Mm.
But there's also stress factor also because that will also come in the management. So that
Yeah.
is also something that you could have asked, like, are you under any stress by any chance? Is there something that's
Yeah.
giving you
Yeah.
stress? I mean, because she said this
Mm-hmm.
is happening more often. Like, so is there something in your life that's kind of giving you more stress? Because she might be stressed about her
Yeah.
job where she has to go and join as a new PE teacher or something like that, right? So
Yeah.
that is something you can
Yeah. Yeah.
explore, isn't it? All
Mm-hmm.
right.
Yeah.
So, likely diagnosis of what? So, whenever you introduce a disease, so literally she calls it discoloration and discomfort. Now, you're giving that
Mm-hmm.
entity of discoloration and discomfort a name. You're calling it Raynauds phenomenon, right? And now
Yeah.
you've just bombarded
Mm-hmm.
her with this medical term. So now you have to tell her that, like, introduce her, give that disease entity a name. So once you give her a name saying that
Yeah.
this is something that we call, this is most likely something that we call Raynaud's phenomenon, and she'll be like,
Mm-hmm.
okay, wait for the reaction. Let's see what, if have they heard it before, have they not heard it before, do they want to hear more about it. So you need to always let them
Yeah.
in on the conversation because it's a two-way conversation, right? So and then wait
Yeah.
for the,
Right.
and she will say, no, I've not heard about this. So then explain it further, tell her what it is, like
Mm-hmm.
give that entity of that clinical diagnosis the description, give the description where she knows what it's called, because if at all she hears it anywhere, she will know what they're talking
Mm-hmm.
about, right? Yes. So
Yeah. Mm-hmm.
then introduce the idea, diagnosis, and then give her the possible reasons of why it could happen to her, right? Because you've told her this has
Mm.
happened to her. What is, and it's basically the overreaction of blood vessels to cold or stress. But why is it happening? So this could usually be genetic, right? It could be usually because of
Mm.
any no other cause, and that could be usually genetic, and that's what it looks like because your aunt also has it, right? But it can also be
Mm-hmm.
due to
Mm-hmm.
some dangerous conditions, which I would like to
Mm-hmm.
investigate further. Yes, before that, you had to give
Yeah.
investigations, where you did investigations very nicely. You did general physical examination, vitals, and I'm sorry, I think my mouse is no, okay, yeah. So, general physical examination, vitals, and you did a hand examination where you saw there was no ulcer, there was no persistent color change. That's very good. And you saw that there was cold test positive. So, that is for Raynaud's phenomenon. If you actually expose them to cold, you can actually see
Yeah.
the whole triphasic change of color, right?
Okay. Okay.
So,
Okay.
yeah. So after that, you can actually ask for further investigations. So now, when you're asking for investigations, so this is what you're trying to look for. You're looking for routine investigations where you can just do ESR, CRP, because these are actually elevated in SLE, right? And which
Mm-hmm.
could be one of
Mm-hmm.
the underlying causes. You need to do CBC as well, where again there could be certain findings that could be associated with secondary conditions that can cause Raynaud's, and
Yeah.
LFT and
Mm-hmm.
KFT, kidney function test. And the
Mm-hmm.
things that you have to rule out, like RA, phospholipid syndrome, and cryoglobulinemia, and SLE, you can actually do further investigations. You can just mention a couple of further
Yeah.
investigation. I would also like to also do certain special investigations, like just mention the names, because if there is a finding for that, they will give it. It could be Raynaud's
Yeah. Yeah.
associated with rheumatoid arthritis, then you might get a positive RF factor finding,
Mm.
maybe, right? So always just
Okay.
mention it,
Mm-hmm.
because that could be a cause.
Mm-hmm.
And then after all this, you can always say that this could most likely be most of the time when you say all this, it's awaited, so they won't even give you a finding. So then you can say that it's most likely what we call Raynaud's phenomenon, and it looks like this could be because of no cause at all. This is something that we call as primary Raynaud's phenomenon, because of no underlying
Oh.
cause, and it's genetic, and it
Mm-hmm.
usually happens in
Mm-hmm.
people, right? There is not much to worry about. So you have to also tell them how much stress should they take about the disease that they have, right? Because if it's
Mm-hmm.
dangerous, you have to
Okay.
tell them you have to come in for a few more tests, you need to do a whole lot of things. But this for you looks like
Yeah.
it could be not something that serious a complaint. This is usually
Yeah.
seen in
Yeah.
a lot of people, right? Especially in your
Mm-hmm.
age group. Like literally, you've given them that comprehensive amount of idea to link them to that disease,
Mm-hmm.
right? And then you can say a couple of things like, but we can always do a couple of things. This condition actually gets exaggerated, especially when you're smoking. Especially when you continuously smoke, this is something that takes a toll on your blood vessels, and this condition can worsen with time given this lifestyle of yours. So I highly recommend and advise you that you try out some of the methods to stop smoking, right? Because that's a big risk factor, right? And then furthermore, there are other things we can actually try. So she said that she goes for jogging without gloves. So these are all data that she's giving you. You need to learn how to use this data in your management. So try telling her that this is actually better when you keep the affected area warm. So if you're going for jogging, try wearing gloves. Make sure you don't miss that, because you want to keep your hands warm, right? And warm your house as well, right? Avoid any sudden change in temperature. So sometimes when they get this Raynauds phenomena, they try to warm it up immediately. You shouldn't do that, because if there is like a rush of blood in the blood vessels, it tends to leak, right? So there is another entity of differential that I want to introduce to. Have you heard of something called chilblains? Right, so this is also a similar condition to Raynauds, which we will eventually we'll cover if we have time, or if you still have the energy to go on. And other couple of things that you can mention is regular exercise, which helps with circulation, and breathing exercise, yoga, which can actually help with the stress, right? They'll actually reduce the stress, and a healthy balanced diet, right? That's what you can do. And what are the things that you shouldn't do is stop smoking. Make sure you ask them to stop smoking. And the other thing, as given in the NHS website, is that do not have too much caffeine. So caffeine is also seen to be one of the risk factors for actually causing this condition, right? So now she might ask you, what are your expectations? She was expecting to get medication. So now you can say that yes, of course, there are medications for this, but how about we try out these lifestyle changes? In fact, we'll see how this works, because if it works without the medication, that's well and good, and we can set up a follow-up to see how well you're doing. Here are some leaflets and pamphlets where you will be more educated about your condition, and if at all you have any doubts from this, you can always come back on your follow-up and ask me all these doubts. I will clear it up for you, right? Like that's like completely giving them an entire idea. Like you have given them treatment, you've given them what needs to be done, you've given them potential further treatment that you can do. You're telling them they will you're giving them resources to read up, and you're telling them that you're allowing them to come back, discuss with you further about how much knowledge they have gained, and tell them how the current treatment plan is working for them. So you need to give them that autonomy to choose what they want to do. And but then she'll be like, no, doctor, I have to go in for this job, and I can't have my hands cold. Sometimes I might not wear gloves, and it gets difficult. So if they're persisting, let's say that all right, if you'd like, we can actually start with the treatment for you, but also try to implement some of the lifestyle changes that we've mentioned. Right, I'll talk to my senior, and we can actually do something about the treatment, because it's not completely in your hands. You have to give autonomy to the patient, right? So couple of safety netting tips that you need to remember. So safety netting for rheumatoid arthritis, Raynauds phenomenon, is that if the symptoms are getting bad, make sure you come back. If it's affecting your daily activity, which is at this current stage, it is affecting the daily activity, right? Like she said that no, I can't do some things. Like don't specifically say that can you hold a spoon and all. Like ask her, is there something that you can't do? Because daily activities is something that you should have an open-ended question. Don't give a close-ended question. It feels like you've read this somewhere, because that might never be the case that you're encountering. They're trying to see that if you encounter this case in real life, how will you perform, right? So affecting daily activity, and if it's only on one side, because then we know that can be a blockade of any blood vessels, or it could be some neurological problem, right? So you need to warn them that this can happen. If this happens, please come back to the GP or emergency immediately, right? If you also have any joint pain, rashes, or muscle weakness, we're actually trying to tell them any of the other secondary causes that can actually have some symptoms that can manifest eventually, right? And the other thing is, if you're over 30 years old and the symptoms of Raynaud's has come for the first time, or if you are under 12 years of age and the Raynaud's phenomenon has come for the first time, because these are the conditions when it can actually happen due to secondary causes, right? So this is something that is actually given in the NHS website, that you need to know that in Raynaud's, if the patient is actually more than 30, it's usually due to a secondary cause. If it's less than 12, it's usually due to a secondary cause, right?
Yeah, okay.
All right. So heading down. So we spoke about the safety netting. We spoke about the patient education on self management and what is Raynaud's
Yeah.
phenomenon, and empathy. Reiterate the support. Like, you always have to tell them that we are here to help you. Like, I'm so sorry that your life has been hard because of this condition that you have been undergoing, but we are here to help you. We are here to educate you in anything that you're going through. That's what you're trying to reiterate. Make sure you do that, because you get points for that. Because there were a lot of opportunities where the simulator was like, oh, I can't do this, I have this problem, I have that problem, and just go with the flow. Say, I'm
Yeah.
so sorry that you're actually having to face this, right? So
Yeah, that's
encourage shared decision making. That's very important, because what are their expectations? You are actually here to fulfill their expectations. Even though the first line of treatment would be lifestyle changes, but if they are expecting something more and they insist on it, you should try to fulfill that. Even by talking to your
yeah.
seniors, if this is something that you have to do out of your first line of treatment, talk to your seniors, right? Respect patient autonomy, and in conclusion, always make sure you give leaflets and pamphlets. So that is something that you can include at any point of your management. Like, here is this is something called
Yeah.
Raynaud's phenomenon. In the beginning itself, when you're explaining what is Raynaud's phenomenon, you could have just mentioned this is Raynaud's phenomenon. I would like to give you some leaflets and pamphlets that can help you,
Okay.
understand this condition a little better. Yeah.
Okay, yeah.